Health officials in Georgia are looking into whether the flu killed a 5-year-old boy. Eli Snook died on Saturday. His parents say he suffered an infection in his brain. On Tuesday, the virus killed 15-year-old Georgia high school student Kira Molina. Mark Strassmann is at Children's Healthcare of Atlanta Eggleston Hospital with more on this story. Mark, good morning.
Good morning. At last count, Georgia has had 37 flu deaths. The state's single flu season record is 59, and health officials expect to top that soon. And behind each of those deaths is a family story like this.
He was the son I've always wanted. I've always wanted a baby boy.
That 5-year-old boy was Eli Snook. His parents, Leota and Aaron, say he came down with a high fever nearly 2 weeks ago. They took him to urgent care near their home in Marietta, where they say he was diagnosed with the flu and prescribed antibiotics and the antiviral medication Tamiflu.
After he got well from the flu, a few days later he got sick again.
Aww.
Eli tested negative for the flu this time, but doctors noticed a rash across his body and sent him to Children's Healthcare of Atlanta.
I see his face, and he's biting his jaw, and his arm goes in, he starts having seizures.
He was placed in a medically induced coma while doctors performed a CAT scan and a spinal tap, but the virus had spread to his brain.
His brain swelled past the point of no return, and they told us that he was brain dead.
Nurses surrounded Eli at his bedside while his parents prayed for a miracle.
Unfortunately, the Lord took him home, and it was Saturday at 10 o'clock.
Eli's parents say he did not have a flu shot. Dr. Daniel Salinas is chief medical officer at Children's Healthcare of Atlanta.
The best line of defense to prevent influenza is to get a vaccine.
If your kids are sick, don't take any chances.
You can't really know these things. It just happens.
The Snooks buried their son on Wednesday, and because of the flu, Children's Healthcare of Atlanta has seen record numbers of patients at all 3 of its hospitals and all 7 of its urgent care facilities. John?
Mark, thanks.